I am Dr. Chiadi Ndumele. I am a cardiologist and an associate professor in the Department of Medicine at Johns Hopkins University. And today we're talking about the American Heart Association's new presidential advisory on cardiovascular kidney metabolic health. And we are, as Johnny described, a nephrologist and a cardiologist that are coming together to talk about cardiovascular kidney metabolic health, as well as cardiovascular kidney metabolic syndrome, which we also can refer to here on as CKM syndrome. And this is really a concept that's relatively new that we believe can redefine both heart disease management and prevention, and can start to break down some of the silos in healthcare as represented by the two of us coming together. The first thing that I think is important is to understand why this is important. Why is CKM syndrome such an important challenge? So first of all, it's exceptionally common. At least 1 in 3 U.S. adults have 3 or more risk factors for CKM syndrome, representing at least 90 million individuals. But really the most important challenge related to CKM syndrome is premature mortality. And that premature mortality is primarily due to an excess burden of cardiovascular disease. And what we know is any one of those CKM syndrome components that we're going to be talking about is related to premature mortality. But when there's a confluence of those factors, as we often see in clinical practice, that has a synergistically increased risk of mortality. Secondly, we also know that all these systems of the body are connected, but that's not always reflected in our healthcare system. We have lots of challenges with fragmentation of care. Anybody who's taking care of a patient, whether you're a primary care physician or a subspecialist, has easily seen challenges where a patient says, "Who do I listen to?" People are talking from different playbooks, and their recommendations are sometimes a little bit divergent. Additionally, we know that some patients, particularly those from more socially disenfranchised backgrounds, have even more challenges with navigating the health system and addressing multiple subspecialists and multiple comorbid conditions. And that's leads to another important point, which is addressing social determinants of health. And social determinants of health are remarkably important to considering CKM syndrome. They're related to the development of CKM syndrome. They're related to who gets identified early as having some of these CKM syndrome risk factors. They're certainly related to the care for CKM syndrome, both self-care as well as care within the context of the health system, and they're related to the likelihood of complications from CKM syndrome.